Here we go. See if this works. Well, it works there, but it's not working on there. There we are. Great. Thank you. So the first question people ask always is, well, what is a comprehensive cancer infrastructure and how does that differ from a comprehensive cancer center? And we gave a lot of thought to this right as we were answering the grant application. And we looked at the precise words, of course, of the grant application, and we concluded that an infrastructure really is a wider concept than a comprehensive cancer center. It's an even wider concept than even a comprehensive cancer network. So if you start in the middle blue box and you think of what a comprehensive cancer network should really comprise, which is perhaps a comprehensive cancer center or very large clinical center, smaller clinical centers, research institutes, units of general hospitals, diagnostic units. We saw actually yesterday some good examples of comprehensive cancer networks in various member states that cover the whole patient pathway from prevention right the way through to survivorship or rehabilitation or palliative care, etc. But the infrastructure might be considered as being wider than that. So the yellow box outside, which would also include such public functions as public health, screening, primary and community care, and population cancer registries. So that's really the whole infrastructure, really, that supports the cancer patient and pre-being a cancer patient for those who have not yet had a diagnosis of cancer. So we've been very ambitious in making that very wide definition. Having done so, we then said to ourselves, well, what really is capacity building? And as Giovanni has just said, it's a complex, it involves a complex series of interventions. And it could be considered really on three levels. Yes, training is an important part of capacity building. So the individual level of individual professionals, their skills and development is very important. But it's also at an institutional level. It's looking at the capability of institutions, doing a gap analysis, identifying barriers to development and growth, sharing best practices between different organizations, building teams, building resources such as data, and the old one, changing corporate mindsets to become more dynamic. But it also involves capacity building the whole system. So breaking down silos between different institutions. We know that, obviously, universities have their own separate funding mechanisms, separate from hospitals, and that causes, sometimes tensions which need to be resolved within comprehensive cancer infrastructures. So it's kind of redesigning the system and making it sustainable. Wrong one. And then we asked ourselves, so this is a Horizon Europe project. It's primarily about research and innovation, but it's research and innovation that is practical, that actually changes and improves the patient pathway and improves the lives of citizens, offering them screening and early detection. So this is our scope really of this project. Any aspect of research and innovation of discovery and translational research or clinical research or outcomes research and other forms of innovation, including digital innovation, how does that really accelerate into making practice changes for patients in the clinic and for healthy citizens, underpinned by, in the green, human resources, real-world data, population registries, etc., and ensuring equality of access. So here are very briefly, are the steps of capacity building. First of all, and most importantly, and we'll be hearing more details about that in a few moments, to define quality indicators that we're talking about and to define the maturity model against which or from which the impact of our interventions can be measured. So setting a baseline and creating a model that can actually track the improvements and the changes. That also involved, number two, profiling each member state and a few associated countries in terms of, do they have CCIs? How mature are they? What do they cover? What's their organizational capability? And we know, as Giovanni just said, there's huge variability across Europe. And then number 3, designing these tailored interventions. We're told by the European Commission to give priority to member states who either don't have any CCIs, or they're very informal, or they're not very well mature, to give priority to those. And then to deliver, first of all, online training courses, and the online offer is definitely one of the key offers, but also on-site interventions, number 5. And we defined perhaps the most labor-intensive form of intervention as being a deep dive, which is a consultancy exercise. I'll say a little bit more in detail of this. And it can't be offered to all potential CCIs. We limited ourselves to 9, where really they're deep interventions where groups of experts and consultants will go into a situation, find out what needs to change, find out what the ambition is, and really help them as established experts to move ahead and to make the development that they need. That will be underpinned in point B by 3 capacity building conferences, again orientated towards the widening participation countries. Number 6, of course, that development needs to be sustainable, it needs to be able to be scaled up, and it needs to be evaluated. So there's a work package that will evaluate the change between point A and point B of all of the interventions by the end of this project, which is a 3-year project. Then, of course, we need to disseminate and exploit the results. There has been a massive digital survey, and I want to thank everybody, and there are some in the audience I can see, who did answer that survey. 42 different CCIs answered the survey. We recognize that, some of the questions were complex, but actually the whole scenario, frankly, is quite complex, because there are some institutions that have responsibility for screening, others that don't. Some have lots of translational research, others don't, etc. So it was a complex survey, but you've done extremely well by 42 institutions and groups of institutions actually replying to it. I won't say anything more on that particular slide. The 8 themes, if you look at the blue box on the left, these are the themes of the maturity model. It'll be explained in more detail in a moment, but it's the structure of the CCI. How is it structured? How is it put together? Is it informal? Is it formal? What's the scope of it? Which institutions are involved? Number 2, is there a comprehensive cancer center within that network? What are the interfaces between care, research, and education? And then specific themes on the research subjects: discovery and translational research, clinical research, outcomes, a section on screening and early detection to the extent that it is relevant and within the scope of that CCI, and then finally the whole patient pathway, and that's everything to do with patient care that requires and will benefit from research and innovation. So as I say, the deadline to the first phase of that survey was the 31st of May. 43 groups replied to that and are therefore eligible not just for the deep dive interventions, but for lots of other interventions as well. These are some of the interventions. I've already mentioned the online courses. In fact, I've already mentioned everything except for preceptorships, which are, as you know, they're the kind of mentorships, really, that could be done over a longer-term basis, usually personal, but can be team mentorships as well. And then one-off visits to one of the sites of an expert. Imagine you want to improve your early phase trials capability. And you might be offered, therefore, an on-site visit to a center that actually has a very good early phase trials capability to learn from them. And to learn, what not to do, what the challenges are, what the resource requirements are, etc. The deep dives. So the purpose really is to help the CCI build their capacity in particular domains by this expert consultancy advice. 3 site visits offered to each of them, a detailed diagnostic period, an intervention design phase, and then a follow-up phase, where the infrastructure really feels they are taking ownership of this issue. The one thing that's dreadful about consultancy, and I used to be a consultant, many, many years back in a non-healthcare field, is that the consultants stop their work, go away, the funding stops, and everyone says, well, what do we do now? And the change really has to be sustainable. You have to make sure that there are people accountable for carrying on the change and implementing it. So we're managing this on a project management basis. Every deep dive site will have a project manager. Every deep dive site will have an expert chair who's a senior oncologist, researcher, or a director even of a cancer center. And they will be given funding to have a local project manager to coordinate the local resources. And so different selections of those themes and domains might be chosen for each theme. You know, one CCI might want an intervention in patient pathways development or patient empowerment. Another might actually want to focus on developing clinical research or on the structure of the CCI. We've established an amazing team of experts, 101 experts, with expertise in precision cancer medicine, in clinical trials, including early phase trials, experts in patient pathway, advanced radiotherapy, nursing, you name it. We've got a whole panoply of experts lined up to help those who will be selected for a deep dive. And they will use structured interviews, they'll use group work, logic models, comparison of best practices, etc. And there will be tools and resources available in a resources center, which we will be setting up for the project. Is already being set up. It's probably a bit small for everybody to see, but I've mentioned many of the domains of expertise. I haven't mentioned surgical oncology, but we've got surgeons, we've got molecular pathologists, we've got people who are experts in education and training, and in survivorship and rehabilitation, and in cancer registries. So really across the board. And there will be these 10 one-day courses organized by the European School of Oncology, which will be offered free of charge and open to anyone to register. So no limitation on that. The first one of those is on the 4th of July. Basically, the first one we decided, well, to try and answer the basic question, how do you form a comprehensive cancer infrastructure and how does it operate? That's the target audience. We've already got lots and lots and lots of registrants, so that's fantastic, but we can keep taking more. The regional conferences will be very important. They won't just be, you know, speaker to audience. They will be interactive, there will be seminars, there will be use cases that delegates can bring and say, look, we've got an issue here. We've got an issue about developing patient empowerment in our CCI, or an issue about, you know, developing an early phase trials unit or whatever. What's the issue here, and how can the experts and the other delegates help to plot a way ahead for them? So the first of those regional conferences is in the lovely Warsaw on the 10th and 11th. I'm looking at Ivona there, who will be the host of that. And please do, this is a big plug, most important thing you need to listen. If you'd like to come on this regional conference, it is offered free of charge by the funds here, and it will focus on the themes of translational cancer research, innovation, digitalization, etc. We'll have very good speakers and the opportunity for you to bring your use cases. So please go on the CCI4EU website, see the details of the regional conference, and please sign up and register. We're looking for teams principally because we think that if, you know, one individual, you know, comes from one institution, another individual comes from another, you're not really going to get that change. But if a team of 4 people says, yeah, we're going to come together to do, you know, nursing empowerment and find out the details and the challenges of that, that's fine. That's far more likely to achieve a change in an institution. There we are. Sorry, I preempted that. The first regional conference, bringing research insights. That's misspelled, isn't it? Infights. I jolly well hope there won't be much infighting. Certainly not started by me. Anyway. Insights into clinical implementation. That's one of the best misspellings I've ever seen, actually. So 100 participants will be selected to attend, and you'll need to submit your CVs with your registration form. And I mentioned preceptorships, but anyway, I've already talked about that. Clearly, the system wants me to go to my last slide. So with that, that's the introduction. Thank you for your attention. I go on to the experts now who are going to talk about the maturity model and how that works.